And the last synovial joint we need to talk about is the ball and socket. As the name implies, in a ball and socket synovial joint, we have a ball-shaped head of a bone fitting into a socket of another bone. And we find the ball and socket synovial joint in our hip when we look at the head of the femur articulating with the acetabulum of the os coxa bone. And also we find the ball and socket synovial joint between the head of the humerus and the glenoid fossa of the scapula, which is our shoulder joint. And the shoulder joint is specifically named glenohumeral joint, making a reference to the glenoid fossa of the scapula and the head of the humerus. Now, since the ball and socket synovial joint is literally a ball in a socket, you can expect that this type of joint will allow movements in a multitude of axes, in several axes. And that tells us that the ball and socket synovial joint allows multi-axial movements, and as a consequence, the ball and socket synovial joint falls into the multi-axial joint category.